Hey guys, it's your girl Future Nurse Thompson. I'm back with another video, and today's video I just wanted to discuss what a CNA or a tech is and whether or not you should become one while in nursing school or before starting a nursing program. So for those of you who don't know and are thinking about becoming a tech or a CNA, they're pretty much the same thing. A tech is more so a name that is given for a nursing assistant that works in the hospital, versus if you're working in long-term care or a rehab center, you're most likely going to be called a nursing assistant. Me personally, I am called a care associate where I work, and I work in assisted living / rehab. That's the type of building that I work in. So for a nursing assistant, their job responsibilities pretty much is to help a person get ready for their day and assist them with what they call ADLs, or activities of daily living. And that just consists from anywhere from hand washing, personal hygiene, as in, taking a shower, bathing, toileting, helping them get dressed if they need help rearranging things in their room, just helping them do things that they can't do themselves or that they need a little bit of an assistance doing. And there's different levels of assistance that you give, and just to quickly get into that, pretty much someone is either an independent person, which they are there just most likely for rehab, or they're like a high functioning dementia patient. And then you have someone that just needs supervision, where they pretty much can do everything on their own, but they just need some, like a setup more so, where when I say setup, I'm referring to the person that with their supervision, you just need to lay out their clothes for them, but they can get dressed, or you can set up the toothpaste and their combs and brushes, and they can do all these things, but they have trouble maybe opening the cap for the toothpaste, or if they don't see it, is out of sight, out of mind for them. Or someone who you just have to tell them, what to do. They'll do it, they just don't remember the order that it needs to happen. That's someone who needs supervision. Even with, maybe just walking an ambulation, down the hall, they're just someone that you have to walk by their side to make sure they don't fall, because 9 times out of 10 they're using their own walker and they still have the ability to walk. Versus your independent, they just get up and go whenever they're ready. The next level of care that you would have is independent supervision, and then it's limited assistance. Limited assistance is someone where they can do everything. So I have someone that's pretty much they're independent, but when it comes time for going to the bathroom, he doesn't have the ability to pretty much clean himself. So what I do for him is I help him clean himself. He'll go to the bathroom, he'll do everything, like he can pull his pants up. Just for whatever reason, he doesn't have that range of motion where he can clean his bottom himself. So that's something that I would do. Or for someone who's had a stroke, the same thing. Very, very, very limited assistance. They pretty much can do everything. They just need like a little bit of guidance transferring, or they just need you to pass them some things so they can get the job done a little bit easier. Then you have someone that is an extensive assist, and with someone who's extensive assist, pretty much what you're doing for them is you're actually having to do this. So when it comes time for extensive assisting and you're getting someone dressed, you're actually getting their pants, putting their pants on their legs, pulling their pants up. That's extensive assist, where you're actually using your muscle to do that, even though they can maybe lift their legs to help you, but you're doing majority of the work. And then you have your clients that are totally dependent upon you, where they have lost the muscle function, they can't lift their legs up. So not only are you getting their pants and putting their pants on, you're pulling them up, but you're also moving their legs in the positions that it needs to be moved, because they no longer can do these things for themselves. So you'll have someone, when it comes time for bed mobility, when they're totally dependent, 9 times out of 10 they're a 2-person, because they cannot hold onto the side rails, or they don't have any ability to move themselves and hold themselves on their side so you can clean their bottom. That's someone that's total assist. So for me, being a nursing assistant while in nursing school, because I kind of digressed off real quick, being a nursing assistant while in nursing school, for me, it definitely has tied together the different things that I've seen. Has helped me connect the dots, if that makes any sense, where I'm seeing my Parkinson patients. And for Parkinson's, the first person client that I had, she was an older woman where she didn't do much. She was very sedentary. But then I've also met Parkinson patients that are very high functioning. So it helps you see the disease process in a different light. So if you're slightly ignorant to what a disease process may look like in an early stage or a late stage, being exposed to that while being an aide, you get to see the disease process in its entirety. You get to see what the nurse is actually doing for the patient. The one facility that I will visit every now and then, I love going there because I can, talk to the nurse and I can see everything she's been doing. Like I'm almost shadowing her while I'm working. So I'm learning how to better interact with people and ask the right questions. Are you in any pain? When was the last time you had a bowel movement? I'm actually doing a physical assessment while I'm inside my client's room, and I'm helping them get dressed and get ready for their morning. So it's actually pretty cool that I get to practice that physical assessment. Or when I'm following the nurse around and she's giving out medications, I'm looking at the medications and I'm going, okay, I see what this is for. And I get to see when it actually peaks and how it affects the person and what it does to help them. So being a tech before becoming a nurse definitely is beneficial, but the disclaimer is that you do not need to be a tech before becoming a nurse. So that's just my take on it. For me, it's very helpful to be an assistant and see the disease process and hone in on my skills for my bedside manner, because pretty much you guys, I'm pretty sure everyone has come in contact with that one person that works in healthcare and you go, how did they even get a job in healthcare when they have to deal with people and they have no people skills? So becoming a tech or becoming an aide is definitely one way to increase your people skills and become more comfortable with going into rooms and providing care for residents, being as though that's the first thing that you learn. Fundamentals of nursing is providing that basic life care for someone. So you learn how to do all of that and you see it done by the nurse. Another thing that I appreciate about being a nursing assistant is that I get to see my nurse in action and I know what it is that I expect from my nurse and my nurse knows what to expect from me. So I kind of know both sides of the table, if that makes any sense. So the questions that we were talking about in class is whether or not you need to be a CNA or if it's a good idea to become a CNA before going to nursing school. I think it's a great idea, but it's not a necessity. It's not a requirement. And that's pretty much it. After you finish your first clinical rotation at most schools in Pennsylvania, you are able to take the nursing assistant's test and exam, and a couple of the people that I'm in class with actually did so. So I'm just going to wrap up this video, but should you be a tech before becoming a nurse? I think while in nursing school, it's a great idea. If you have the time to work while in nursing school, it's great. Go ahead, go for it. Get that experience and you're building relationships with other people, not just with your residents, but with future employers as well. But is it required? Is it needed? No, you don't need to be a nursing assistant or a tech. It's just getting experience, and it just makes you a better nurse, in my opinion, when you have worked in each level or at least understand it. Because let's face it, when you're in nursing school, whether you're at the practical level or you're at the RN level, when you're going to clinical, you're only spending what maybe at best my first clinical rotation. Fortunately for me, I was already a nursing assistant, but we spent less than 8 hours actually with the residents. I want to say we got there at 7 and by 11 o'clock we were off the floor. So we helped out with getting people up out of bed. We helped with breakfast. We helped with toileting. We took people to different appointments that they needed to get to. And then we helped out with lunch and anybody who needed that second and third change, in between for the total care clients. And that was it. 4 hours, 1 or 2 days a week is not enough time to develop the skills and perfect them. So becoming a nursing assistant before going on to be a nurse, definitely a great idea. Because like I said, you only get 4 hours, sometimes 1 day a week or twice a week. That's not enough to hone in on those skills. They say you don't learn something until you actually do it 7 different times. Well, if those were 7 brief times, one day we went to the floor, both my residents were already up and out of bed. I had nothing to do. So could you imagine if I was that nursing student and I needed to learn, how to give a bed bath or something of that nature, and there's no one to give a bed bath to? You don't get to practice these types of skills. Or if I need to practice, changing a brief or log rolling someone, and there's no one to log roll, how do you practice those things? You can't. So my take is, yes, it's okay to become a CNA before you become a nurse. So I'm going to end this video. You guys have a great one, and I will talk to you later.